Hello, Mr. Goodman. My name is Makenna. How are you doing today?
Good.
All right. So, how have you been dealing with things so far?
I've been all right.
Okay. Well, I see that you have been diagnosed on your case history with laryngeal cancer, and I just want you to know that I'm here to help prepare you for your surgery and some of its possible outcomes. So, I want you to know that I'm here just as someone you can trust to support and guide you through this process. And you can feel free to ask any questions at any time if you have any.
Okay.
Okay, so to start off, I'm going to tell you some of the basics about laryngeal cancer. And laryngeal cancer is a cancer of the voice box, which is also called your larynx, medical term. So yeah, that's part of your throat. And I've got a picture here to show you. It's just right there. And this kind of cancer, it can be treated with surgery, and sometimes that'll be your entire voice box that's removed, or sometimes it's just part of it. But other things with treatment are like radiation, chemotherapy, and what's called immunotherapy. So those are just kind of the main treatments for this type of cancer. So your voice box or your larynx is what helps whenever you swallow, eat, breathe, and talk. And there are some different possible outcomes of this kind of cancer. And so it can lead to problems in your speech and swallowing, your eating and diet, and also your breathing, or it can be a combination of all of these things. And so there's also different stages of this kind of cancer. Do you remember what stage your doctor said the cancer was in when he diagnosed you?
Yes, it's stage 1.
Okay, so this is considered early laryngeal cancer. And there's an early stage and an advanced stage. So as your doctor probably told you when you were diagnosed, the tumor, which is a growth that's there, is probably somewhat small, and the cancer is still in your voice box. And so, in other words, it hasn't spread yet. And this is good that things that have been identified for you this early. So next, we'll just go over how the surgery works. You'll probably be given anesthesia and pain medicine. So you want to make sure you have someone to take you home after the surgery is over. And just to get ready for the surgery, you want to make sure you talk to your doctor and tell them about all the medications you're taking. And they can tell you when to stop taking them before the surgery, because things like aspirin that thin the blood will need to be stopped before you have the surgery, so you won't have any more risks involved with the surgery. And you'll probably also not be able to eat or drink for a certain amount of hours before the surgery. So you just want to make sure that you follow all the doctor's orders that they give you and plan ahead so that you can have the surgery on the planned day that you're supposed to have it, and so that it can go as well and as smoothly as possible. And then one last thing that you'll want to make sure you do before the surgery is just to check in with your doctor. Make sure you have what's called an advanced care plan on file with them, and this will show them what your wishes are and for your health care, and it'll also be good to have just in case that you need it. So that's another thing to look into if you haven't yet. So next we'll cover the risks of your surgery. So this type of surgery depends on how much of the cancer is taken over your voice box. So you might only have part of your voice box removed, but if things spread, you could also have to have your entire larynx or voice box taken out. So if you have what is called a partial laryngectomy, this means that you'll have part of your larynx or voice box taken out. And after this happens, you'll have the chance of having problems with your voice, speech, breathing, and swallowing, like I told you before. But if you have a full, or it's also called a total laryngectomy, which is where you'll have your entire larynx or voice box taken out, this means that you'll have to find new ways to communicate, because it can leave you with no voice, and you can also have problems with breathing and swallowing with this. So if you have a total laryngectomy, the surgeon will make a new place for you to breathe as well. And so instead of breathing through your mouth and nose, it'll be a spot in the throat, and this process is called a tracheotomy, and the hole is called a stoma. And this can be temporary, or you could have it permanently, and it'll be in this spot right here in my picture. And so it's important that you take care of your stoma if the surgeon were to do this. At this point, things are looking, if you can get your surgery rather quickly, we might not have to have a total laryngectomy, but just to prepare you for potential risks and things that could happen down the road. Or if the cancer were to come back, that's just another thing to be thinking of. And so if they were to give you a stoma, they would give you a list of instructions on how to care for it and do things. And also, if you were to have a total laryngectomy or have voice problems, you would probably have to learn new ways to communicate by things like talking through your esophagus. And your esophagus is located right here in this diagram, as you can see. And so you'd be getting a hole in the throat between your esophagus and your trachea. I'm sorry. The total laryngectomy would be talking through your esophagus, which is there, or you can also get an electric voice box, and that vibrates when you talk. Sorry about that. But you'd be getting a hole in between your throat, in your throat between your esophagus and your trachea, which is shown here in this picture as well, and that'll help you get air out and speak if you were to face communication problems. And so just some things to be thinking of that will happen after the surgery. You'll probably only be able to eat through a feeding tube for about a week after the surgery so that your throat can just heal up. And usually people can go home in about 1 or 2 weeks after they get the surgery, but it'll probably take a while just for you to adjust to all the new things that you might face after the surgery. And there are some ways that I and others can help you after your surgery. So some of the ways that I will probably be helping you after the surgery is over is, for one, your speech, language, and voice. We just want to make sure we keep your communication as good as possible throughout the entire process. And if you're still able to use your voice after the surgery, we'll work to preserve it and make it as functional as possible for you. But if the surgery ends up causing you to lose your voice, we'll work towards communicating in other ways and make it as smooth as we can to transition for you in the whole process. And another thing we might end up working on are cognitive activities. So these, we can just use these activities in our therapy to stimulate your mind, keep you thinking, and keep your brain working and functioning well, regardless of how things are with your communication. That just might be a good thing for us to look into. And another thing that I can help with is your swallowing. We'll probably be working on different ways to help you swallow effectively, and we might have to change part of your diet to make sure that you can swallow safely just while you're eating and drinking and doing things. So those are some of the main things that we will probably cover, and I'll be here to answer any of your questions, help you through the process of everything, and refer you if you need to receive any other forms of therapy sessions or see another healthcare provider if I see other issues that I can't address myself. And so I know this is a lot of information, so I'll give you this packet here, and it'll highlight what we went over today, and you can look back at it and share it with your family. Is there any other thing? Do you have any questions for me?
No, not at this time.
Okay, well, if you do have any questions later on or just need reassurance about anything after the surgery is over, please just let me know. Here I've got my business card for you and your packet.
Okay, thank you.
No problem.